Parker, who's the Chief Operating Officer at Oldham Clinical Commissioning Group, and Katrina Stephens, who's Oldham's Director of Public Health. And we're holding a live Q&A to give an update about the coronavirus situation in Oldham and also to talk about how the vaccine programme has been progressing. So I just wanted to jump straight into the first question, which was, how is the vaccine programme going in Oldham?
Hi, Charlotte. It's good to be back again. I think the vaccine programme is going really well in Oldham, to be fair. We're one of the higher performing localities in Greater Manchester. I'm pleased to say we've administered 138,411 vaccinations at first and second dose since the 14th of December when we started. That's 56% of our adult population now have received their first dose vaccine. And we're now starting to see quite a dramatic change in the pattern of vaccination as we get more into the second doses. We've focused very much so far on the first 4 cohorts initially. We completed those by the government timeline of middle of February. And then we moved on to the remaining 5 cohorts. We would describe them as 1 to 9. Those cohorts broadly are everybody over 50 years of age, and we've offered people over 50 years of age their first vaccination dose in line with the government timescales. About 3 weeks ago now, the government finally enabled us to start moving into the younger cohorts, basically all working age adults, and we're currently working through our programme of vaccinating that cohort, starting with the over 40s. So all going well. It's not without its challenges. I'm pleased to say that we are getting through it, and I think 56% of our adult population done with the first vaccine, and I think it's about 20% now complete on the second. I think is a really, really healthy start, and we're starting to see some of that in our transmission rates and the protection of individuals, which I'm sure Katrina will talk much more about as we get into the Q&A.
Yeah, anything you wanted to add to that, Katrina?
No, I mean, just like Mike says, really, the programme is going really, really well, and that's, thanks to Mike and his colleagues in the CCG, all the GPs who've been involved in rolling that out, and all the members of our communities and our community groups who've really championed the programme and really helped people to access the vaccines as and when their time comes to be able to access them. So no, it's the programme is going well, but we continue to encourage people to take up their appointment as soon as they're offered one.
Yeah, I was going to say just on from that, the government has set a target of trying to vaccinate every adult who wants to be vaccinated by July. Is that the kind of timeline we're looking at for Oldham? When will all residents expect to be able to get their vaccine?
So I think it's a realistic timeline as long as the supply of the vaccine continues at the rate that it has been. I'm not going to shy away from that conversation in this forum. We had a very clear strategy nationally about protecting life and saving lives, and that's why we start with the vulnerable elderly parts of our population. But in Oldham now, we are changing gear quite dramatically. Katrina and I have been in several conversations over the past week or so about enduring transmission. We know very specifically that we have very, very low levels of infection transmission in our older population now. It's almost virtually gone. There was no infection at all in care homes from either staff or residents. But where we do need to start focusing quite dramatically now is on the working age adult population. And this is where we'll start to see over this next period of time some fairly dramatic changes in how we start to administer the vaccine itself. We have 6 sites up and running across the whole of Oldham, and over the past month, we've been working with people like the Council of Mosques, and what an amazing bunch of people they have been in helping us to get the community out in traditionally difficult communities who are hesitant to the vaccine. We need to start thinking a little bit differently about the approach and style now as we get into this working age population. Of course, people that work 9 to 5 during the day, a lot of our vaccine clinics run during the day. We have a lot of people who work on 0 hours contracts or part-time work. that is in the evening or at weekends. So we're starting to need to think a little bit more creatively about the manner in which we deliver our vaccine over this next period as we start to target different groups. And of course, from our point of view, we've moved from a place of roughly seeing 300-400 people through a normal GP practice to putting on different sites as part of this work we've been doing over the past month or so. In places like the Millennium Centre, where we've been seeing 1,200 people at high level in a single day get their vaccine. So you can start to see the difference of approach and the need to think a little bit more about mass vaccination sites. And I think that might see us reduce the amount of sites down in the whole of Oldham from 6 to 3, but sites that can take a lot more people in a lot quicker timeframes. And we've still got a little bit more work to do to figure that out, but I'm pleased we're getting there on that one now.
Katrina, do you want to chime in?
I don't think I've got anything to add on to that one, to be honest. I think Mike said it all in terms of that plan. So I will save my input for a later question.
Yeah, I mean, following on from that, I was just wanting to know what the biggest hurdles have been in terms of rolling out the vaccine.
So there isn't one single thing. I think there's a combination of different things, and it's different in different places. So for those people that might not necessarily be as aware of how the national programme works, there are basically national vaccination centres all across the country, and they are run and controlled, and the booking process is controlled centrally through Department of Health and Social Care. For us, that centre is at the Etihad Stadium. And when I look at our figures, 20% of those people who live in what I would describe as the east part of Oldham, Saddleworth, and that part of the borough have been happily going to the Etihad Stadium for their vaccination, whereas only 5% in the central part, Glodick and Wearmouth, have been wanting to go down to the Etihad Stadium. That national mass booking facility is then supplemented with locality-based sites, and we have 6 of those in Oldham, and we've been running them traditionally out of what people would describe as reasonably big-sized GP practices, where there's good flow, good ability to keep people socially distanced. But over the past month or two, we've been targeting specific communities much more at areas where we've got lower levels of uptake. And some of the things that we found quite significantly, those people who live in the more affluent areas are more willing to come forward for their vaccination. And so we've been looking at how we encourage different kinds of access points in different places. So we've used the Millennium Centre down in the centre of Oldham. We've used the AIC Centre in Chadderton, and we've also used Greengate Street Mosque as a vehicle to try and really bring things a bit more closer to the community, but targeted at specific community groups. The other issue I think that's proved quite significant in our population has been vaccine hesitancy. So we've had quite a lot of reports from younger females who are concerned about the vaccine and their ability to have children. There is no evidence whatsoever that the vaccine has any detrimental effect on fertility, and we've been working quite a lot with some community groups and staff groups to try and push that message out. We've worked really, really hard with some parts of our Pakistani and Bangladeshi communities to really talk and help them understand the vaccine and the ingredients that are in the vaccine to make sure that it's halal. We've also done quite a bit of work now with the homeless communities. Traditionally one of the more vulnerable parts of our society, but a part of our society that's been at real risk of being missed out. And I'm delighted to say Oldham was the first borough in the whole of this country, I think might have been the world actually, to vaccinate homeless people as a purposeful strategy. And other people quickly followed us through that, but we did that by really starting to understand where the risks and concerns were. And then for us, that gives quite big challenges about how we move the vaccine to people. And we've learned an awful lot over that period of time. And then I think the final hurdle really is the kind of constant traipsing out in the national media of risks associated with the individual vaccines themselves. And I've no doubt in my mind, and the figures that we are seeing, that when it comes to AstraZeneca and the big hoo-ha there was 2 or 3 weeks ago I think partly created by some of the noise internationally. We're having to do an awful lot of work to reconvince people that the AstraZeneca vaccine is perfectly safe, and it's always been perfectly safe. We're starting to see a different set of headlines now about the Moderna vaccine, which has just come online, but we have not received the Moderna vaccine at all in Oldham just yet. And equally, the Johnson & Johnson vaccine is, people start to say the same. I do recall there was noise about the Pfizer vaccine at the early stages of that. So, we're having to adjust our messages and our educational processes quickly and agilely to make sure that people have got good information. I still come back down to it's really, really important that people take up the vaccine, and if people are hesitant, worried or concerned, we're trying to do all we can to give them access to not just information on things like websites, but actually phone calls from nurses and doctors in the area to kind of try and understand that a little bit and encourage them into clinics and work with them. We've put on all kinds of different approaches to people with learning disabilities and autism who might need really quiet surroundings. So we try to organise them at specific times in the day in specific parts of a building to make it a little bit easier. So I think we've accommodated an awful lot of needs in a way that perhaps people don't necessarily always realise. And the way the older population has responded to that has been nothing short of remarkable.
Yeah, I mean, what we've seen is that you've had a really strong take up in older groups, but that potentially now that it might be harder to get younger people who might be less at risk anyway of taking up the vaccine. I was just going to ask Katrina what you thought about that.
So I think from what we've seen so far, actually, and particularly when the vaccine programme started and it was just the older age groups that were eligible, actually we were getting lots and lots of requests from younger people wanting the vaccine. So I do genuinely think that the absolute vast majority of people out there are keen to have their vaccine and have it as soon as possible. And the risks of COVID are less for younger people, but the risks are still significant. We see lots of people developing long COVID, and this vaccine program and people taking it up is important for us to be able to see our way out of this pandemic and for us to get back to normal. But I do have every confidence that people will want to take up the vaccine. I think as well we have an advantage really in that actually there are a range of vaccines available. So the approach that's been taken with the AstraZeneca vaccine, and for anyone who's under 30 and not been vaccinated yet, for alternatives to the AstraZeneca to be offered, is about an ultra cautious approach being taken. The risks with the AstraZeneca vaccine are incredibly low, but because we've almost got the luxury of there being alternative vaccines out there, we can adopt that different strategy that allows us to respond to that even very small level of risk in our approach.
Have you seen that there has been some level of an increase in vaccine hesitancy since the decision to advise people not to offer AstraZeneca vaccines to people under the age of 30? Because I can see that people in maybe the 30 to 40 bracket who aren't included in that guidance might also have some concerns about the risks for them, even if they are, as we say, sort of very, very, very small.
So I wouldn't necessarily point it just at the under 30. I think we saw a marked sense of anxiety in the population when the blood clot headlines started to emerge, and we've done an awful lot of work to try and alleviate those concerns. And there is a risk with every vaccine and every immunisation, no matter what it is. To put that into context, if there was a risk in Oldham, you're talking about one person in the entire population. It's that small. However, that is a very significant concern for people, and we recognise that, which is why we've gone out of our way to really try and target specific groups to bring them back in. And what we saw. How we saw that manifest itself was people basically saying, I don't want to come for the vaccine unless it's Pfizer, for example. So for those people, we've embarked on a much more one-to-one conversation with them about what their concerns are, why those concerns exist, why we think it's why that's not the case, what the medical evidence shows. And in the main, people have largely been happy and pleased with that type of response. And then come forward for their first dose vaccine. One of the real challenges we've got at the moment, I don't think people necessarily see things in this type of way because it's not very visible. The vaccines that came in the early days were for us were Pfizer vaccines quite specifically. And now, of course, we're looking at second dose vaccination. That supply of Pfizer is really about making sure that we provide a second dose to those that had Pfizer on the first dose. So, it's not that we have a limited supply of Pfizer vaccine. It's the Pfizer vaccine that's coming is actually being targeted quite specifically at those that had the first dose. The AstraZeneca vaccine, of course, is different. It's in a different supply chain. It's manufactured in much greater scale and is therefore more readily available. And I think we'll start to see Moderna and Johnson & Johnson become more readily available as well over this next period of time. What we're not in the space of, though, yet, and I think this is some of the things that we've been very keen to feedback nationally, is there is no ability for people to be able to choose which vaccine they would like. The vaccine comes to us on the supply chain. We're not able to order it in a particular way. It just comes to us on the supply, and therefore we have to administer the vaccine that comes. We've not once thrown any vaccine away. We've not wasted any vaccine, which is really, really, really pleasing to the logistics and the way that the clinical leads, our GPs, have worked quite hard with their patients to make sure that's the case. I've no doubt in my mind that there are a number of different ways that we can look at the under 30s cohort. On the one hand, I fundamentally think that dropping down to the younger age population will significantly improve our transmission rates in Oldham. It also is a vehicle to help us encourage those younger people that want the vaccine, who have older parents that don't want to have the vaccine. It's a real way of helping us to encourage families to come together and make those decisions and come along and mutually support each other. But equally, I can understand the hesitancy issues for those that read the headlines and are concerned, and we'll continue to work with those people.
Yeah, I suppose just following on from that, Katrina, are you looking at now potentially reaching out to some younger people and asking them to come and take up their vaccine early to try and use the vaccine as a way of cutting the transmission? Because we're seeing that rates in Oldham, infection rates, are still quite high, especially compared to the England average.
Yeah, so the Joint Committee for Vaccination and Immunisation updated their guidance just over a week ago now, and that gives us more flexibility to start thinking about some of those issues as we roll out the vaccination programme. So we know in Oldham that we have got some areas of the borough, some populations where we continually see higher numbers of cases. And so absolutely that is part of our thinking now, is how can we make sure that we are getting the best access to vaccine to the areas in the borough and the people who are most at risk, whether that's through the type of employment that they're doing or but continuing also to think about those risks that relate to age and clinical vulnerability as well, because actually that we've still got people in those older populations and those who have some clinical vulnerability who haven't all been vaccinated yet. The vast majority have, but equally we want to make sure that we've vaccinated absolutely everyone who is willing to be vaccinated.
And I mean, could you explain a little bit about why Oldham is still seeing high rates of COVID-19? It's currently the top of the boroughs in Greater Manchester for its rate, and it was there sort of I guess July last year. The same thing happened, that everyone else dropped down, but Oldham still had high rates, and then of course special lockdown measures had to be introduced, which is something I'm sure that nobody wants to see a repeat of.
Mm-hmm. Yeah, so it certainly last week it did look like our rates were starting to go up a bit again. Quite really pleased to say that actually the most recent data that we've got does look like rates are starting to come back down again, and quite significantly. So that's really, really good to see. But even with that reduction, our rate remains significantly above the national average and one of the highest in Greater Manchester. And I think that's for a number of reasons, really. We know that we have got a higher proportion of people who are in jobs where they can't do those from home, and there are lots of employment when you look across the country where people are exclusively working from home. and that's not the case in Oldham. For our residents, they are maybe going into work, mixing with people every day through their work, which does present a greater risk if there are cases of the virus out there for it to pass on. Similarly, we know that in Oldham, our average household size, so the number of people who live in each house, is higher than the national average, and coronavirus transmits very, very easily within a household. So actually, if you get a case in a house in Oldham, actually the number of people that are potentially infected is much higher than it is in some other areas of the country. So I think those are two really critical risks for us. The other one I'd like to highlight really is that we know that there is a link between the type of work that people do, not just whether they can work from home or have to go in, but also the security of that employment, and that particularly has an impact on some of the really what can feel like a really difficult decision, I think, for people about self-isolation or how cautious they need to be if they feel like they've got symptoms that could be coronavirus. Now, clearly, we want absolutely everyone who is a contact of someone who's got coronavirus or who develops any of those 3 symptoms that are associated with coronavirus, so a persistent cough, a high temperature, a loss of sense of taste or smell, to isolate immediately, and for all of their family to isolate. But we know that can mean sometimes that people feel that they won't have any income, or that their job could be at risk. So there is financial support out there for people who have to self-isolate and lose income as a result. So, but also, I would really encourage people to make sure they're accessing regular testing, because we know that lots of people with coronavirus don't have symptoms, but also to make sure that you're thinking about what are the things that you need to have in place if you did suddenly have to self-isolate, because actually none of us can predict when that might happen. It might be that someone we've been in contact with suddenly develops coronavirus and we have to self-isolate. So really important that you've thought through how will you get food, who's going to walk the dog, all those things that you would do day to day, and have a bit of a plan in place for those, whether that's calling on support from friends and family who might be able to drop things off for you. But equally, we do have a helpline and support available for Oldham residents who that people can access if they've got any concerns about self-isolating and need some additional support.
Great. So I was just going to jump in because there's a comment from James Malloy, who's asked what has been the uptake of vaccines in Oldham, whether we've got a figure for that.
So I think, as I said, we've done 139,000 vaccines roughly, 56% of our adult population. We're well over 90% for our over 80s. I think we're pretty much at 100% now for care homes. Without going into every single one of the 1 to 9 cohorts, 56% of our adult population is a significant number. Our focus now is trying to do second doses at the same time as first doses for those younger age people in our society. So from an Oldham point of view, our numbers are high compared to other places, but we do have pockets of challenges in some particular communities, which is why we're now starting to target those in quite a specific way to encourage greater levels of uptake. So for example, we know that we've got a real push in parts of Wearmouth, in some of our Pakistani community, same with some of our Bangladeshi community, and other parts of Oldham in some of our Black and Afro-Caribbean members of the community. Whereas we also know that we've got pretty much 100% uptake in some of the people that we have listed in our GP registered as Irish and white British. So we're quite clear, and we're tracking and monitoring uptake rates in all parts of Oldham, and where we need to start changing our approach to encourage uptake, then we are doing so.
And Ellie Nunn, who's I think you've already answered this, but it's probably worth stating again. She wants to know, why do you have to travel to Manchester when booking a vaccine?
So there's no need to travel to Manchester when booking a vaccine. There's an offer to book a vaccine at the Etihad Stadium, and that is controlled and managed nationally by the central booking team. I'm well aware they've sent out letters straight from the national database directly to patients outside of the GP processes, and our GPs continue to offer vaccinations to people on their registered list. So, we have a blended approach where people can either travel or stay local. It sometimes happens that, and I think we've seen a lot of this in the early days, where people were in quite a rush to get their vaccination, and for some people they chose to go to the Etihad Stadium. I would generally say, if you've been to the Etihad Stadium, the chances are you're going to need to go back there for your second dose because of the way the supply chains work. But there's no exclusive need to travel outside of Oldham whatsoever. It's an additional offer. If you want to and you're able to and it's convenient and it suits you, then fine, that's perfectly acceptable for people. Otherwise, your GP will be in touch with you and offer you a series of appointments or an appointment at a particular clinic.
So if you can go on the booking website and it offers you the ability to go to a mass vaccination centre, should you also be able to then contact your GP and say, I'm eligible for a vaccine? Can I find out when that would be?
Yes. So, I'd encourage people to bear in mind that it's not always easy to get through to GP practices. So I'm not going to sit here pretending that that's the easiest thing to do. But yes, you can use both those facilities if you are concerned and would like a vaccine at a local GP centre. Then you're more than able to get in touch with your own GP and have that conversation with them. Yeah,
because obviously not everyone has the transport to get into that side of Manchester or the time to be able to get that slot. So if they're only seemingly being offered that, then it's probably worth that they try and chase it up locally.
I absolutely. I think it's about remembering, isn't it? The government set out a series of targets by which certain parts of the population would be vaccinated, and it's tried to arrange the vaccination program in a certain way to enable that as efficiently as it possibly can do. I very much am an advocate of local is always best, but I'm also an advocate of, if you're concerned and want your vaccine quickly and you're offered it at the national centre, then you're more than free to take that up, and that will be at the Etihad Stadium.
And I think you've both mentioned this, and you particularly, Katrina, about how necessarily it might be difficult for people to do that self-isolation period, and they might be worried about bills and having to pay things. I think in the comments, Jane Regan's raised the fact that not everyone's being paid £500 for shielding. And there was a report a few weeks ago which said that it's actually very low numbers of people getting that £500 payment because there's so many exclusionary criteria. Would you say that that's one of the main reasons that we're seeing sort of pockets of reinfection in certain communities, that people aren't necessarily qualifying for this £500 payment, but also would really be financially worse off if they did have to self-isolate?
I think it's potentially a factor. The self-isolation payment system comes with some quite strict criteria from government as to who can and can't, or as to what criteria are that we can pay out and not pay out on. We have been continually working to look at how much we can flex those criteria to allow as many people as possible to receive those payments. And also we continue to have conversations with government as well about where there might be possibilities for some additional flexibility, because we do think it's really important, and it's an area where the impact is very different when you look at different areas of the country as well. And an area like Oldham, I think, is particularly adversely affected by that loss of income and the impact that self-isolation can have.
And just looking back at the kind of COVID rates, should people be worried that there are some areas where we're seeing sort of increases week on week, even though overall there is at the moment there's a drop? We've just seen outside hospitality reopen, non-essential retail. Are we expecting to see that cases are going to start to trend upwards again just because of that reopening?
So I think we all need to continue to be extremely cautious when it comes to coronavirus. Wherever in the country we live, or wherever in Greater Manchester people live. So the trends are positive at the moment in that rates seem to be coming down, but this is by far from over yet. There are lots of good signs that we've got good vaccination uptake and the vaccine program's going well. Case numbers are coming down. And we're all starting to be able to get out and do some of the things that we've not been able to do for ages. So lots to be really hopeful about. However, you know, we are not out of the woods on this yet. There is still a long way to go. So it will be many months still before the whole of the adult population has had both of their vaccines in order to have that protection that the vaccine offers. There are still cases occurring every day, and so you know that creates potential for further cases and for numbers to rise again, particularly as people start moving around more. At the moment, because a lot of the restrictions that have been eased involve people mixing outside, we know that the risks are lower there. But I think particularly with the next stage of the roadmap, that involves much more mixing indoors, which I think is a greater risk than with the current the most recent stage of the roadmap that we're in. So really critical that we keep seeing the reduction in case numbers between now and when that next stage of the roadmap happens. I think another really significant risk is variants of concern. So people will have probably heard about the South African variant and the Brazil variant, and then in recent days as well, the situation in India and the sort of variant of interest there. And I think the risk with some of the variants is that they can potentially transmit very quickly, but also the vaccine might be less effective in the face of some of these variants. So if we do see those spread, or indeed new variants emerge that have those same characteristics, then you know we could be in a situation where we're back into having to see restrictions imposed again. So actually keeping case numbers low is really critical in reducing the chance that we see new variants emerge. But also, you know, international travel is a really significant risk for variants from elsewhere being introduced into this country. So even with the very, very limited number of reasons that there are for people to travel at the moment, we are routinely seeing new cases that are associated with travel. And, you know, I know how much lots of people want to see kind of abroad summer holidays be an option, but I do think that would come with significant risk in terms of the potential for new cases to be imported into the country and new variants as well.
Are we seeing any variants of concern being identified in Oldham?
So we've seen occasional cases, but generally we have been, well, in fact, exclusively that we've been able to do the enhanced contact tracing that's necessary for those cases, identify where they have come from, and ensure that all their contacts and the case themselves have followed isolation appropriately. So at the moment, we're not concerned that we've got widespread transmission of any variants of concern, but we have seen some individual cases.
And would you say going forward that people's attitude is one that they should still be sort of hyper cautious? I mean, we're seeing things like, for instance, like wearing masks on public transport. Those rates are starting to dip. It seems like potentially people are getting a little bit complacent because of maybe the messaging about the vaccine and about hospital admissions and deaths and cases all dipping. But we're also getting scientists warning that we could potentially see a third wave in the summer despite the vaccination programme. What would you say to people who might be wanting to embrace the easing of lockdown?
So I think that, you know, the best way we can ensure that we can embrace the easing of lockdown and continue to follow the roadmap is to follow all the restrictions that are in place at each stage. So that includes, you know, making sure we are following the hands, space, fresh air, hands, space, fresh air message all the time. So using masks, undertaking regular testing, really important as well, because that will help us pick up cases where people don't know they have the virus and could be transmitting it. Making sure you self-isolate as soon as you've got any symptoms, or if anyone in your household has, or if you test positive or a contact of a case. You know, and taking up the vaccine as soon as it becomes available. We all need to work together and all follow all of those to make those easing of restrictions possible, because you know those measures are there to mitigate the risk and minimise the risk. And you know, hopefully if we all do that, we can reduce the chances that the virus spreads, that we see variants of concern, and actually we can keep following the roadmap and get back to normal as quickly as possible.
Mike, I was just wondering if you could give us a little bit of insight into what's happening in the hospital now. Are we seeing that a lot of patients are still coming in with COVID and needing to be treated on oxygen or ventilators, or has that significantly dropped off as well?
Oh, it's very significantly dropped off. I think we're at the lowest level of people with COVID on ICU that we've seen since the start of the pandemic, really. So probably the best way to characterise the activity at the hospital is that it's now pretty much returning back to what it was before the pandemic started. So people turn up at A&E are turning up with general accidents and illnesses. They're not turning up with COVID necessarily. I think we were down to 6 people in the hospital and ICU as of yesterday. There's less than 30 cases in the hospital now in inpatient beds. I do come back down to Katrina's point, though. Our real challenge is managing people with what we describe as long COVID. The impact of having the COVID disease itself or the virus itself. That's our biggest challenge. We're less in the space of major cases in the hospital requiring high levels of intensive care. We can't afford to be complacent. We need to keep making sure that we keep our distance, cover our face, wash our hands, all those kind of basic hygiene factors, whilst also kind of enjoying some of the benefits that the beautiful weather's now starting to bring. It's about doing it in a safe way and being practical about what we're doing. We are going to be very much spending most of our time over this next period when it comes to the hospital dealing with kind of routine surgery and planned activity that frankly was postponed at the start of the COVID pandemic whilst we scaled up some of the intensive care facilities. And I'm pleased to say that we're really in the thick of some of that work now, which is very, very good for those people who've been waiting some time for routine knee operations, for example. But again, it still comes back down to we need people to be vigilant and be cautious with the easing of lockdown. Don't not enjoy it, but be cautious in how you enjoy it.
And I think sort of finally, I just really wanted to ask about, could we potentially see a situation where Oldham might once again be singled out as like a problem borough and have some specific lockdown restrictions put in place? I mean, the Prime Minister has said that this would be the lockdown we've just had is the last lockdown, that sort of pledged that this is the one to fix it all, and then the vaccination programme is going to sort things out. But are you kind of potentially budgeting for there being another period of lockdown in Oldham?
So, I mean, clearly that's something we really want to avoid and really hope doesn't happen. The current framework that's in place nationally doesn't is all about the whole of the country moving together, and we really hope that is something that we're able to continue with. But as we've referred to previously in answers to the questions, we do have some specific risks in Oldham, which means we do tend to see higher rates. So that challenge is always there, and that's why it's really important that even as we move down the roadmap and restrictions ease, that we do keep following all the guidance that's in place, because that will maximise our chances of being able to follow the national roadmap and stay in line with the rest of the country.
And so I think that's pretty much covered most of the stuff that I wanted to ask and most of the questions that we've had about the COVID situation. But I suppose I just wanted to see if you had any final thoughts about where we are in Oldham now, how people should be looking forward to the future, and whether we're going to essentially see the back of this now.
Do you want to start, Katrina?
Yeah, I mean, I think particularly in recent days, actually, the trend is positive in terms of what we're seeing on number of cases. So yes, there are signs to be hopeful. The vaccination programme is going well. We're seeing that reduction in rates, and it's really pleasing to be able to see that people can sort of go out and we've had great weather, haven't we, for the period when we can start socialising outside. So there are lots of reasons to be positive, but that doesn't mean that there aren't risks ahead. And that's why it's really important that we do keep following the hands, face, space message, doing regular testing and taking up the vaccination. And you know, we are in a vastly better position than we were this time last year when restrictions were easing, in that we have got vaccination, we've got regular testing. We've got, I think, the systems that are in place now to, you know, for testing, contact tracing are more advanced than they were last year. So we've got more tools in the box, if you like, to seek to try to reduce case numbers if they do start to rise again. But I just would really urge everyone to remain cautious, really, and to still recognise the significant risk that coronavirus can pose.
I'd echo that very much so, and I think encourage people to self-test if they need to. There are test kits available now, delivered to your home through your front door by the Royal Mail, so you know you can get them at gov.uk. I think the country needs to probably get itself to the space of realising that everybody really should be testing themselves twice a week as a minimum. The other part for me is about the vaccination. You know, your time will come. We're trying to get through the age groups as quickly as we possibly can. I would encourage people to take the vaccine. It will not stop people from getting COVID, but it will certainly significantly reduce the effects that COVID would have on that basis. Much like the winter flu jab, that it doesn't stop you getting a cold, it stops the cold from being very significantly severe. Now's the time, I think, to enjoy some of the lockdown, but do that cautiously and not just simply think that everything's back to as it was before the pandemic, because it is not. You look at our rate of transmission is around about 60 per 100,000. I seem to recall when we had the first significant national intervention in Leicester was about 130 per 100,000. So to put that into perspective, it shows where, you know, we were concerned at 50 when this first started out in Oldham a year and a bit ago. So, you know, it's coming down stably and steadily. And it's coming down because people are generally, I think, getting their vaccine, socially distancing, washing their hands and covering their face. And we just need people to keep doing the same and behaving in the same way over this period of time.
Okay, brilliant. Well, thank you so much for taking the time. And I hope that that's given people a bit of insight into how things are progressing in Oldham and some of the enduring challenges that you're still having to deal with. And hopefully we can do this again in a couple of months and the situation is still going to be positive. So thank you so much.
Thanks, Charlotte. Thank you.